Hi, everyone. Welcome to today's Mother's Day webinar, and thank you for joining us. I'm Ashley Travellini, the Marketing Coordinator at Children's Dental Management, and I'll be your host throughout today's session. You'll get the chance to hear from our pediatric dentist, Dr. Bond and Dr. Skuya, in addition to our special guest speaker, Executive Director Colette Acker from the Breastfeeding Resource Center. They'll be covering a variety of topics, including a baby's first dental visit, the importance of baby teeth, breastfeeding education, tongue ties, and frenectomies as well. Throughout the webinar, we'll feature a few poll questions before each speaker presents their topic and a live Q&A at the end of the webinar. We have enabled our Ask a Question feature, and you'll see on the right-hand side of the screen, you can enter any questions you have, just pop them in that chat box there, and we'll address them at the end of the webinar. If you miss anything, don't worry, we'll be sending the webinar recording in a follow-up email along with a survey so you can provide us with your feedback from today. Before we begin, I'd like to remind our attendees that we're offering an exciting giveaway for those who joined us today, an Honest Company Baby Arrival gift set, and a Brushies book with toothbrush for babies. We'll announce the winner at the end of today's webinar, so please stick around until the end for a chance to win our Mother's Day giveaway. We'll also announce the name live and connect with this person via email for shipping details. We're excited to announce our baby oral health exam as well, and we'll go into a little bit more detail about that at the end of the webinar. You'll notice here on the side, the first poll question has been running already since the start of the webinar, and if you haven't answered already, please just take a second to submit your response. I see them coming through. So it looks like, majority of our attendees are moms today, and then we have other being listed as well. So once again, welcome everyone, and thank you for joining us. I'll now turn it over to Dr. Skuya, and you'll see her first poll question pop up. So we'll give everyone a second to respond to that question as well, and then she'll introduce herself. Publishing.
Awesome.
Okay.
All right.
Great.
We'll start the presentation. Hi, everyone. My name is Dr. Skuya. I'm a board-certified pediatric dentist. I've been a dentist for about 12 years now, and I've been with Children's Dental Health for the last 3 years. I practice at the office in West Grove and the office in Exton, both in Pennsylvania. And I'm very excited to be presenting today and to meet our audience and my co-speakers. I'm a mom myself of 2 young children, and I can relate to a lot of the topics that we're going to be discussing today. So I'm excited to get started. So let's get started. All right, so we're going to touch base on childhood tooth decay. It is the most common chronic illness in children. It's actually more common than asthma. 1 in 4 children will have a cavity by the time they're in kindergarten. But I think I want to emphasize that tooth decay is a complicated disease, and it's influenced by many factors, biological factors, social factors, behavioral factors, environmental factors, but it also is a preventable disease. And so one of the key ways that we prevent tooth decay is with early intervention. And that starts with establishing a dental home, finding a pediatric dentist that you're comfortable with, where you can continue to find care for your child. The American Academy of Pediatric Dentistry recommends that a child sees the pediatric dentist within 6 months of their first tooth coming in, and no later than their first birthday. So there's a campaign called Get It Done in Year 1, and so we're advocating for this. When you go to the pediatric dentist, one of the things that they look for is any early signs of tooth decay or any active tooth decay, and of course discuss ways of preventing tooth decay from progressing, ways of early intervention. Sometimes you can reverse early tooth decay, and also treatment if it's necessary. And then we also evaluate the child's oral and facial development. There are times when we need to intervene in the way the jaw is growing, the mouth is growing, or other structures in the face and the mouth are developing. We also determine a child's fluoride needs. We believe that fluoride helps with preventing tooth decay. And so we assess what the child's needs are and give you an individualized plan. And we also diagnose dental injuries. As you guys know, young children are very curious as they explore the world and learn to walk. You know, dental injuries are pretty common. So those are one of the things that we assess for. And then we coordinate care with other healthcare providers. And you'll see from the presentation today, you know, dentists collaborate with many different healthcare providers in providing the best care for our children. And then I also want to emphasize how imperative it is to have early appointments, especially for kids with special healthcare needs, because they have unique challenges and they may be at a higher risk for developing tooth decay. All right. So when we talk about prevention, I just want to start by asking, you know, answering why are baby teeth important? So baby teeth are important for several reasons. They help a child to speak clearly. They help the child to chew naturally. And they also form a pathway for the adult teeth to come in, which is important for proper development of the jaw and the facial structures. And one of the first ways that we prevent tooth decay, and we know it's effective, is with good oral hygiene habits. So when it comes to cleaning your child's teeth, we want to use a soft bristle toothbrush. And you also want to use a toothbrush that's the right size for your child. And the toothbrush is the mechanical way with which we remove plaque from the teeth. So the bacteria make a film on the teeth, and that bacteria can cause tooth decay. We scrub it off with a toothbrush. If you have an infant who doesn't have teeth yet, you can use a soft bristle brush on their gums very gently to clean that. Or you can use a wet cloth, which is easier and more accessible for some families. And that should also get them in the habit of getting their teeth cleaned before the teeth come in. And adults should always brush for the children, because at a younger age, they lack that manual dexterity or those hand skills to really do a good job when it comes to brushing. Brushing should happen twice a day, once in the morning and once in the evening. Now, with toothpaste, we recommend using a fluoride toothpaste. And for infants and toddlers, so children under the age of 3, we recommend that you use a very small smear on the toothbrush. Use a toothpaste in the size of a grain of rice. So that's a really small amount. But it provides enough fluoride to help with preventing tooth decay. And you can use that quantity twice a day. For children who are older, between the age of 3 and 6 years old, you can increase the amount of toothpaste to about a pea-size amount. And you want to encourage children to spit at that age, so that way they can minimize how much they're swallowing. For older children past 6 years old, you know, they can use different quantities and different tools. But I wanted to focus on the younger age group now. And the next thing is diet and nutrition, because it's very critical for cavity prevention. And I find that sometimes it's also something that takes time and patience to change if it needs to change. Fermentable carbohydrates in the diet, if you have them frequently, or if you have a diet that's rich in them, that can put you at risk for tooth decay. So just like pediatricians, we recommend a balanced diet, a very colorful diet. Introduce lots of fruits, lots of vegetables, lots of whole grains. And if your diet allows milk and dairy products, meats, fish, and eggs. You want to limit how much sugar and starch the child gets, especially when it comes to snack time. And this is another area where pediatric dentists can sort of guide you and give you specific detailed advice for your specific needs. I also wanted to touch base on baby bottle tooth decay. And this is an old term. In the 1970s, it was also called nursing decay, baby bottle tooth decay. And it was used to describe the kind of cavities really, really young children get. At that time, it was believed that breastfeeding the child or giving a child a bottle is what's causing the cavity. Now, 20 years later, we've learned more, and we understand, like I mentioned earlier, that tooth decay is a very complex disease. So there's lots of factors that can determine whether someone gets a cavity or not. So our recommendations have changed around that. the American Academy of Pediatrics and the World Health Organization recommend that a mother breastfeeds the child exclusively up to up to 6 months if possible, and up to 1 year, and then wean when the child and the parent are ready for that. The American Academy of Pediatric Dentistry recommends that you avoid nursing a child to sleep or giving a bottle that has anything besides water in it to fall asleep when the teeth are up. So if a child has teeth, to avoid those habits, putting them to sleep with that. And then I also wanted to talk about who is a pediatric dentist. And I think the best way to describe it is that dentists are the pediatricians of dentistry. They limit their practice to treating children only. A pediatric dentist goes through additional training after dental school, 2 to 3 years. And so they're exclusively trained to treat infants, children, all the way through adolescence. And for children with special healthcare needs, a pediatric dentist is usually their dental home and their resource for their dental care. When my family members, when my friends ask me who to take their children to, I always recommend a pediatric dentist. But I think ultimately what matters is that you're comfortable and that this is someone who can take care of you and your family for a lifetime of smiles. So that connection is really important. For the expecting mom, I really wanted to emphasize the importance of oral health. Women are more susceptible to oral diseases because of the hormonal changes that come with pregnancy. So the normal physiological changes in pregnancy can cause you to be nauseous, they can cause vomiting, you can have acid reflux, and then your gingival tissue is friable. So all these factors can change how you normally eat, how you what your dental care regimen might be. And that could potentially put you at risk for getting cavities, for having gum disease, and for also having some dental erosion. So having a dental home that you can go to for urgent care or for routine preventative care is really critical at that stage. Poor oral health in the expected mother has been associated with a decreased birth weight, with growth restrictions and preterm delivery. And then besides that, I also wanted to emphasize that there's always a safe and comfortable way of providing dental care for the expectant mother. So don't feel discouraged, especially if it's something urgent. And with that, I'll conclude my presentation and hand it off to Colette. Thank you.
Thank you. That was great.
Thank you.
Just want to make sure I'm doing this right. Hi, my name is Colette Acker. I'm a board certified lactation consultant and the executive director of the Breastfeeding Resource Center. I do have a poll for you guys. Oh, everybody's already done it. You guys are way ahead of me. But while we think about that, I wanted to tell you a little bit about our office. So we help families reach their breastfeeding goals, bottom line. And we work with families from birth until weaning. We have several hospital contracts, so we do all the inpatient care at 2 local hospitals. And then we also have 2 outpatient offices where we see things like painful feedings, the baby won't latch, low milk supply on mom's side, poor weight gain for baby, fussy babies, pumping questions, returning to work, really anything that you might need in that postpartum period. We offer support group. They're not that big during COVID right now. That's an old picture, but hopefully soon we'll open it up and be able to fill the rooms again. And also we have virtual classes that you can attend, like starting solids and topics like that. Once you are finished working with the lactation consultants, you have an option of getting one of our community counselors. And so we have 65 community counselors. And these are people who've come through the BRC, gained a passion for breastfeeding, and took a 6-week training class on how to counsel families and learn more about some issues. So we really like to take care of everybody full circle and have support set in place to have that done. We are a nonprofit, so all of our services are provided on a sliding scale of payment if insurance doesn't cover the cost. So what I wanted to talk about today was how do I end slide? Stop slide. Got it. What I wanted to talk today was some, breastfeeding myths. And after you guys responded to your poll, will eating gassy foods give your baby gas? That's a common question we get. And in reality, the answer is no. So the Monell Institute right here in Philadelphia actually did a lot of study on this. And they found that the foods we eat, they give us gas because it's a fiber going through our intestinal tract. And so it's the chunks of broccoli going through our system. Thankfully, we don't have chunks of broccoli shooting out our nipples because that would be horrible. So really, you can eat whatever you like, and it's not going to impact the baby's behavior. There are some people who swear that if they eat a certain food, the baby is fussy, and so they stop eating it, and that's fine. So let's say it's onions or something, but don't go telling all your friends to stop eating onions while they're breastfeeding. So it might be very individual. And in rare cases, some babies have an allergy towards a certain food or towards a certain food protein. And in those instances, a woman may have to eliminate that food from their diet. But it's pretty rare, and the biggest culprit tends to be dairy products. So if you have a gassy, fussy baby, there are some breastfeeding management things we can work on before we would go to diet elimination, because it's no fun. All right. If you guys have any specific questions that you want answered, feel free to put them in the chat box. And hopefully the moderators will help me with that. But I'll go over some other questions that we often come across. Sometimes we hear families say, oh, I heard breastfeeding really hurts and that you just have to toughen up and stick it out. And that's really not true. The number one reason for pain is bad latch and bad positioning of the baby. So it's really important to get that down. And that's what the first few weeks of life is sort of figuring this all out. It's, it takes two to tango, and you've got a brand new partner here. And it takes some time to get comfortable with it. And it's like starting any new task in life, like learning a new computer program. You feel like a fumbling idiot at first, but then it becomes second nature. And when it comes to latch, if it hurts, it means the latch is wrong. So there's good latch, there's normal pain and not so normal pain. So what we consider normal is the initial latch on pain. That's some discomfort in the first 30 seconds to a minute of the feeding in the first 2 weeks of life. That we consider normal. What we don't consider normal is pain throughout the entire feeding or boo-boos on the nipple. That is not normal whatsoever. And believe it or not, sometimes it's a quick fix. It's a minor adjustment of that baby and positioning them a little bit differently. And you could have immediate comfort. And sometimes it's a little more tricky, but to reach out for help if you're having pain. Don't stick it out, because sometimes it's not going to get better. How about never wake a sleeping baby? So, our support system tends to be our family members, and you get all kinds of advice, and it can be really, really wrong sometimes. So what I want you to think about with breastfeeding and babies is that there's no cookie cutter answers, and you're giving birth to a human, not a robot. And so really important to look at the big picture. Let's say your baby was born a little early. These kids are typically very sleepy. They don't give you the right feeding cues that other full-term babies give you, and they may sleep right through a feeding. So it's very dependent on all the things that are going on of whether you're going to wake a baby or let the baby sleep. I think I have time for a couple more. So babies will start to bite once they get teeth. Well, there have been some, I'm not going to lie, but it is not something that we lay out that it happens to everyone. So there are tips. If you do have a baby who likes to clamp down, it's typically at the end of the feeding when they're finished feeding and they're just goofing around. So it just takes a matter of getting them off before they start playing around. But really, biting is a rare issue. There is no benefit to nursing after the age 1. So this is not true. That's false. The advantages of breast milk after the age of 1 don't end. I think years and years ago, I remember I heard someone say, "Oh, I heard it. Your milk turns to water after the kid is 1." And I'm like, why? Why would that happen? So if you think about in our culture, most people are nursing for about a year and then switching over to a cow's milk. In many cultures, they look at us like we're crazy. They're like, "You do what? You then do what? You drink another mammal's milk? How weird is that?" So when you look at the length of time people breastfeed, it varies all over the world. And part of it is dependent on your culture. And so there are many people who nurse their children to ages 3 or 4 because really children should have milk for about that time. And so they choose to continue to give their human milk rather than to switch to cow's milk. So keep that in mind, and you will see a trend in the United States as more and more people are nursing into toddlerhood. It's very different from nursing a newborn. It's sort of, oh, nap time, bedtime when they fall down and have a boo-boo. So keep in mind that there are still benefits long after a year. All right, that's it for me, unless there's any other questions.
Now my audio is on. That leads to me, guys. So we'll pull my poll up here quick. I think I have one question on there, but while they're pulling it up, my name is Paul Bond. I'm a pediatric dentist. I'm the program director here at Temple University Hospital's Temple Pediatric Dental Residency Program here in Philly. So my home base is here in Philly at our Philly office, and I work out of here and get to teach all the residents here, and also treat and see all the infants here at this office. So which is unique. I wasn't ever trained to this growing up, or, as in residency. This is something I kind of learned later on. There's a couple really great lactation consultants. There's tons of them. Excuse me. There's a couple really outstanding ones that taught me some stuff here in Philadelphia, and Colette was one of the first ones too that really got me kind of into this. And I just wanted to thank her personally for giving her time today and doing this. If any of you guys, when you have your kiddos, reach out for a lactation consultant if you don't get one from the hospital. But Colette, they have offices in Wayne and also in Abington, right across from the hospital. So great people in there. Like you said, she's in there with a couple other people, and then there's lots of other community advocates that help out too. So, but anyway, I was asked to talk about tongue ties and frenectomies because this is after you've seen Colette and, you're still having some problems breastfeeding, your kid's still not kind of where they should be as far as, discomfort. The kid's either clearly having some issues, or the mom's still lingering, having some issues, and you've worked with Colette a few times or anybody along that line. Sometimes I come into play. So, not always, but sometimes I do. And a lot of times I will see parents come in and we'll look at kids and kind of see what's going on with them. If they have something structurally wrong with them, there's something anatomically off that can be, slightly modified, adjusted. And then in turn, can we actually then resolve the kids' issues or the mom's issues, or ideally both of them? So I'll talk about some short-term things with some frenectomies, and I'll talk about some other long-term things, how this can kind of impact some things as your kiddo gets older. So, and real quick, our question was, do you think tongue ties are more common in boys or girls? Again, by the research, it's slightly more towards the boys, but again, not too much. I'll touch on the why here, but so you probably all heard the term tongue tied. Some of you guys probably think is that even a real thing? I thought that was just a made up thing. I thought that's something my grandfather told me about, just a figure of speech. It's really not. So first thing, we'll talk about frenulums. Frenulums are these pieces of anatomy. All of you guys have it. So take your tongue and kind of like look under there, look in a mirror, or kind of run your tongue up on your top lip. You kind of feel a little string of tissue, a little piece of tissue there. So those are all normal pieces of tissue that we all have. It's just a remnant of our development. So again, you can see these pictures here. So little kiddos like that, you'll see these little frenums like this, and they kind of attach low in the jaw. But again, this kiddo's lip, the very first picture, it rolls out of the way really nice. So again, when this kid goes to latch on to either the bottle or at the breast with mom, he should be able to get that lip out fairly well, not cause mom too much discomfort or any issues, and also have the lip flange out. So it makes a really nice seal. So it keeps all the air out and then can make a nice vacuum. So that's kind of what you want to see. However, though, sometimes we see kiddos with lips that don't roll out that way, and sometimes that piece of tissue needs to be fixed or amended, so it'll help with the nursing. A lot of times, in my experience, tongue ties are the bigger issue, not just lip ties. Like that's the first thing I talked about. But that second picture there, you can kind of see that really thin little piece of tissue that holds that kiddo's tongue down to the floor of their mouth. So their tongue really can't work like it's supposed to. And when you understand the mechanism of nursing and the mechanics behind it, it's like having your shoes tied together and trying to run around the block. Like you'll be able to do it. You'll get there. It's going to take an awful long time. You're going to fall a few times along the way and scuff your knees up. So if you can get that piece of tissue released and out of there, and allow that tongue to kind of function normally on its own and an independent, a lot of times the kids will stop doing the bad things they were doing, whether it was, biting and chomping and chewing, or just having really, just odd behaviors when they're trying to breastfeed. So this is something that's really easy to fix. It's something we do here in the office. Your kiddo, if you end up in this situation, we bring your kiddo in, we ask you a whole bunch of questions about your nursing history. We ask you a bunch of questions about your kiddo, and we take a look at them and kind of see what they're up to and see what things look like and feel like. And kind of like Colette said, it's not always something so straightforward and so simple, like this is the only problem or this is the only issue. A lot of times there's a lot of other things, how your kid was born and how they developed. There's certain things we can fix and amend. There's certain things that time will fix. So, but either way, it's a very profound results and get improvement. Sometimes it's a big step in the right direction. Sometimes it's a small step. Sometimes it's the whole entire problem. So again, this is kind of what I was going to talk about here for a little bit. So what is Xafrenectomy? Again, it's, removing that piece of tissue. We use a laser here. So it's the same thing if you went to the dermatologist, you had to get a mole removed or a skin tag or something. They use the exact same thing. But before we even get to that point, again, like Colette said, I want you to go see her. I don't want to be the first person you see. Now, I will say sometimes there's kids that are so badly tongue-tied that 3 people in the hospital before you even left have told you your kid has a tongue tie and you should go get it fixed. You can bring that kid in as soon as you want. We'll gladly see them because it's probably that glaringly obvious. But you have to follow up with a lactation consultant on the back end pretty soon after. A lot of times tongue ties are not as glaringly obvious. They're more subtle. They're kind of hidden. They're less obvious. But again, after a few weeks of, sometimes a few days, sometimes more like a few weeks of struggles with nursing, if you find that you're feeling like I don't know if I can keep doing this. I don't know if I can manage this. Try to get some help. And sometimes something simple as this can get you back on the horse and get you fixed up. So a lot of times too, again, not everyone chooses to breastfeed. There's nothing wrong with that. That's a lot to do. It's a lot to ask. If you have other kids at home, we encourage it. We'd hope you do it. If you don't, we get it. Life happens. There's lots of things in life that happen, lots of challenges. So it's not just about breastfeeding too. A lot of kids will come in, not as many, but we'll still see a lot of kids come in with bottle feeding issues. They choke with bottles, they gag, they have a really hard time taking a bottle. And that could be as simple as just finding the right bottle. It's like a lock and a key I say here at the office a lot. Your kiddo's the lock. We can't change that. Well, we can find the right key for them. So we can kind of find what fits for them. Whatever their anatomy is, however they look, we got to find the right bottle. You guys, if you've had kiddos or if you're in the process of pregnant or in the future here, you guys will be overwhelmed when you go to Target or wherever and you walk down the baby aisle and you see how many bottles there are. There are so many different shapes and sizes and flow rates and all this stuff. But sometimes just the most simplest of bottles is the easiest for these kids to handle. So again, we'll see a lot of kids too come in. So if you think you have a bottle fed kid or you're bottle feeding your kiddo and you find that they're having some issues nursing from the bottle and can't really get a good seal, they take a ton of air in, they choke, they gag, they're just not a happy kiddo. Look into this because you may have the wrong bottle or you may have a tongue-tied kid that's why they have a hard time bottle feeding. So So if you do come in the office and we make the recommendation or the decision that a revision or a fixing that frenum needs to happen, we use a CO2 laser. The procedure is really quick. All these kids are awake for this. It's like, if you got your kiddo's ears pierced, you don't put them under anesthesia for that. It's quick. It's a little uncomfortable, but it's very fast. So that's how you have to kind of weigh it out. We'll do both the procedures in the same day if they both need to be done. A lot of times we just do the tongue. Sometimes we do both if we need to, but we only really do what needs to be done to kind of get the alleviation or the fix that the kid needs. So, but again, that's something we do here in the office. It's the kids are awake and alert, and it's really quick and easy, and the parents can nurse right afterwards. Sometimes it's an instant fix. Now that's sometimes more of a myth than anything, because sometimes I got my kid's frenum fixed and everything changed right away. A lot of times that, it can happen. More so it takes sometimes a week or two for the kid to adjust, the mom to adjust, and everything to kind of come in line. So you have to have a long-term outlook on these things too. A lot of times I hear from, pediatricians or certain doctors or certain individuals or whatever, like why this happened. Is it a fad? Is it something that's, just talked about, or I've never heard of this, anything like that. Again, the reason why it's not talked about is because, years ago, back in the 40s and 50s, formula became more of a common normal for a lot of us. And that became the norm. Years before that, turn of the century, formula really wasn't a thing. You had to breastfeed your kid for them to survive. So as the world changed and wars changed and life's changed and moms are off to work and dad's at war, whatever else goes on, bottles and formula became more normal and became more of a replacement, sometimes a much easier replacement for things. So again, tongue ties weren't talked about. Nursing wasn't as big of a deal. So what happened was over time, they weren't talked about. It kind of didn't exist. So, excuse me. The reality is, with individuals with really obvious tongue ties, most likely you as the parent or your spouse or your significant other, they most likely have it as well. And if they don't, look back to your siblings. Look back to your spouses, your significant others' siblings. You may find that they actually had the same issue as a kid. They were a picky eater. They were only bottle fed. Whether that was your parents' decision or not is up for discussion, whatever. But a lot of times that was the big issue then. So a lot of times this is a genetic issue. Someone, the mom or the dad, whoever, most likely has some issue that goes on. And then probably your other kids have it too. So I usually find that about half the family will usually have it. So if I ever see 4 kids from a family ever, about 2 of them will have it. But at any rate, so again, sometimes your other kids have it. And sometimes, even if it doesn't, I didn't have any problems nursing or my kid bottle fed really well. Sometimes you start to have other issues as a toddler. And there's kids that choke on food. They gag on food a lot. They're really picky. They have a really limited diet. They love carbohydrates, but they hate to chew like proteins and stringier meats and things that are more difficult to chew. They have a really hard time with those things. So, excuse me. So is it easier to address when they're an infant? Sure. It's probably the easiest time to do it. Again, that it's warranted, it must be done, it's needed. So that's the bigger thing. Can we do this when this kiddo gets older? Sure, we obviously can do it. We do this in the office here. Sometimes they need to be sedated because of behavior, especially the toddlers. Sometimes they don't. Sometimes I've had 2- and 3-year-olds come in. They're amazing. They do really well. We use the same tools, same everything. We use the laser, make them a little bit numb to make it a little easier for the kiddo. And then that's about it. So again, later on, these kids end up usually going through some feeding therapy, things like that. That's how they kind of end up here because, some of the behaviors have not kind of changed. So I think a lot of people talk about having, excuse me, speech impediments and speech issues with having a tongue tie. And can that exist? Absolutely. It certainly can happen. But a lot of times it's more individuals and kids will kind of accommodate, they kind of compensate, they figure out that's what they were given by nature. And then usually they will kind of address that and just kind of deal with it. Kids might end up in speech therapy, may have prolonged speech issues that, take some time to resolve. Sometimes it's a normal, like we don't expect our 2- and 3-year-olds to say they're ours. It's just not a normal thing. That's more of a 5- or 6-year-old sound. So. So, and this is kind of what things look like, just to kind of show you guys, this is kind of a frenum that in my books is tighter. It's, this mom's symptoms, this kid's symptoms meant some kind of threshold in my book that caused issues that we said, hey, you've worked with Colette or someone, qualified like that, and you have had no resolution and no improvement. Well, let's remove this. And then hopefully with the removal of this piece of tissue, we can have some more function with the tongue. And then all these issues, or again, maybe most of the issues, will start to resolve. So this is about a 2-week difference between when we do the revision and then after it heals up. So it looks like there's really nothing there. With that, then in theory, then you have, full range of motion with this individual's tongue. So is it too late? We always do this. We do this at different ages. I'll see certain kids come in right from birth. I'll see kids come in a couple of weeks. I'll see kids come in a couple of months. So we see them at all different times. And like I talked about, we'll see toddlers, we'll see school-age kids come in. There's a lot of other things, long-term health implications, some sleep stuff, some growth and development of their jaws. But again, like Colette kind of touched on, there's a lot of, it's never just one simple thing. It's never just that one thing usually makes the world difference. A lot of times we'll see kids that have had pacifiers for prolonged periods of time that really cause some issues too. So the sooner you can get your kid off the pacifier too, the better off you're going to be long-term from growth and development, and the happier I'll be when I see them, and hopefully, their bite will be nice and there'll be less issues there. So again, I talked about this for about an hour and a half last night to a group in Minnesota. So, this is just a nice little 10-minute quick breeze overview, but just to kind of bring it to your light. And be wary of what you guys always read online. Don't fall in the trap of always falling into things on Facebook and other places like that. So hopefully you see some really good professionals that are really grounded and have your best interest in mind. We can kind of lead you in the right direction and also lead you away from things that you don't have to have done. So if you guys ever have questions, and once your kiddo shows up, that's our website. It has a lot of detailed information about tongue ties, frenectomies, just a lot of questions parents ask. Hopefully that can answer a lot of your questions. And if you feel that, seeing us or looking into this more is something you need to do, there's a new patient tab, and you can kind of download the intake form and send it over to us with pictures, and we kind of assess those, look at those, and then try to give you some guidance based on that. So I think the time is up here, so I'm going to, yep. So.
Okay, great. Thank you, Dr. Bond. We appreciate it. Oh, if you just want to slide back there, you can go to you can keep it on this slide. So we'll do Q&A at this point. If you haven't already submitted your questions, please do so now, and we'll give everyone a chance to respond here. The first question it looks like we had is from Dana, and Dr. Skuya, I'll push this one to you. But the question was, my 2-year-old had all of his teeth. When should I take him to the dentist? He can't talk, and with COVID, parents can't go back with patients.
Great question, Dana. I think at 2 years old, I would take your child to the dentist immediately. So take the first available appointment. There are ways of getting around that. So at our practices, we do allow parents to come back with children that young, especially when it's your first visit and you probably have a lot of questions. That way you can have some one-on-one time with the provider. And if you haven't been to the dentist during COVID, we take a lot of measures to make sure that the environment is safe for you and your child. So just be prepared to wear a mask. The staff, the doctors will be wearing masks and following a lot of guidelines, but it will not prevent them from doing a really thorough assessment on your child and addressing some of your concerns and questions. But I would definitely take them in right away.
Great, thank you. One more for you here. From Veronica, my 20-month-old is getting her back teeth in and wants to gnaw on things. I feel like she has too many teeth to have frozen teething rings to soothe her gums. What is your recommendation on what I can use to help soothe her gums besides baby oral gel?
For children that young, we always recommend the cold teething appliances. So that teething ring is actually a wonderful tool. You may want to have a few on hand so that you can switch them up when they, soften up. You can switch to a colder one. You can also take a washcloth and put it in the freezer, and that could help as well. It's an easy thing to teeth on. And I want you to know that teething is just a normal process. It's very uncomfortable, but it's not something to be extremely worried about. I would discourage the use of Oragel, and most pediatric dentists do. The reasoning is that the benefit or the relief you get from the Oragel is very brief. And then the side effect is that you're swallowing a lot of that medication, and it's not safe for your child to have it, depending on how frequently you're applying it. If your child is that uncomfortable, you can give them children's Tylenol or Motrin, so an over-the-counter pain medication in the right quantity. So you want to follow the directions that are appropriate for your child.
Great. Thank you so much, Dr. Scuia. Colette, I'll float these couple of questions to you now. From Hazel, do breastfeed babies need oral care?
Well, yeah, I guess that actually should not be my question. But if Dr. Scuia, I'm sorry, I always screw up her name. If you address that, I don't want to take over your job.
Yes, so all children should get oral care, whether it's home care. We talked about brushing or using a washcloth to wipe their gums if they don't have teeth. And if they do have teeth, bring them to the dentist. So whether they're breastfed or formula fed, they still need that care. And, if your child is not one yet, but they have teeth and you have a lot of questions, go in early. You don't have to wait till that first birthday. And like I mentioned earlier, that relationship, that connection with the provider, you should have someone that can counsel you and give you the advice that you need for every stage that you go through with your child.
Great. The next question, can anyone share about whether or not more caries are developed for breastfeeding babies versus formula fed?
Okay, I'll touch base on that, and maybe Dr. Bond can chime in as well.
Yeah.
I don't know of any studies or any research that exclusively, compares children who are breastfed to children who are formula fed and then controls all the other factors. So my answer is that no, I don't know of any difference. But remember that it's a multifactorial disease, so there's a lot of things to take into consideration, whether your child's going to have a cavity or not. And Dr. Bond, you can chime in.
I don't need to. You said it. So no, it really turns into there's so many other variables. So again, Dr. Scuia talked about fermentable carbs. Like, what does that mean? So like, I take the time to really explain, like, pretzels, chips, things like that. They're all carbohydrates. Carbohydrates break down the sugar. Sugars feed the bacteria. So it's not what our parents always told us, you eat candy, you're going to get cavities. Sure, that's not helping. It's the acidic value of the teeth, what you're eating, and it's also the complex carbs. So like complex carbs, white bread, things like that are really not a great situation. Snack foods, that kind of stuff gets a lot of kids in trouble. But as far as breastfeeding goes and, formula, I don't think there's a difference. It's really what else gets added to the mix that's really going to cause the problems. And again, how active or proactive or inactive the parent is in keeping the teeth clean as best they can. So again, there's lots of layers to it.
Okay, great. Yeah, and Dr. Bond, you can probably jump in on this one. Are pediatricians trained to catch tongue ties? I feel like my son had one because of troubles nursing, but pediatricians said no.
Yeah, it's interesting. Like, there's a few groups around here in Philly that I see stuff come from their offices, and they're on top of it all the time. They're really good with it. I think those individuals have taken a vested interest in breastfeeding, and they're compassionate to it, and they understand it, and they appreciate it, and they support it. So they're more proactive, I think, to look. Some pediatricians are, and some pediatricians aren't. It all goes to where you went to school, how you were trained, how you went to residency. So it's not across the board. Everyone's the same. So, that's why I think if you get multiple eyes on things, if, you have Colette look at it, and, Colette can't diagnose it, but I'll tell you, Colette knows a heck of a lot about it. So she can at least give you a referral to someone who can look at it. We can look at you as somebody else. And then from there, I can make that determination. I don't need the blessing of your pediatrician. It's always nice to have their support, but if you've met a threshold of issues, then, you're your best advocate for your child. So speak up. And being a new mom for the first time is very difficult, but you have to not necessarily look for answers, but make sure you're satisfied with the answers that you've got. So.
The other problem in the pediatric world was that we switched from breastfeeding to bottle feeding in the 40s and 50s. And you don't have to have perfect tongue mobility to get milk out of a bottle. So they lost the need to clip frenulums, and they stopped teaching it. So there's a whole slew of physicians who weren't even taught about it. Now it's back in the curriculum.
Great. Thank you both. Next question. I'm interested to hear if lactation consultants are hired in any dentist's offices. It seems to me these two go hand in hand. Do other oral health providers recognize the importance of this collaboration? Is this a common discussion in the oral health field? Sounds like it.
We don't, I mean, I think having a lactation consultant here it wouldn't be practical. It sounds like a great idea. I think when you go for support like that, it's nice to be in the company of, probably other women that are going to the same thing in a group, setting, or in a setting where it's, it's not a dentist's office. It's more of a private, either individualized location, sometimes at your home. So have there been offices that hire lactation consultants? Yes. Could we keep them busy the whole day? I mean, probably not. So, and not everyone that has to see a lactation consultant needs to see me. A lot of times I want you to see Colette, and then, maybe 1 in 10 kids she sees or whatever need to come see me then. So again, to have her here, probably wouldn't be advantageous for me basically, but if, you always go see her first. So,
it's always like, if you were in my office, we wouldn't utilize you as often as you would need to be utilized either. Right.
So, and then the other question was about other oral healthcare providers recognize the importance. Again, there's more talk in orthodontics and braces and airway stuff that, we should kind of understand this stuff. But again, it gets the waters get very muddied. It's a very long, drawn out conversation with some stuff. But we talk about this more and more about frenectomies, I think, in dentistry, especially pediatrics, in the last probably decade. It's been more and more, and the pediatricians see it more, the ENTs see it more. So a lot of people, it's out and about more often now. So.
Okay. Great.
Can I add also that among dentists, we have so many specialties. And so some specialties, like Dr. Bond had touched on, would be more familiar with this, issue. So again, pediatric dentists might be more familiar with that challenge than, say, a general dentist who maybe sees many, fewer children than a pediatric dentist does.
Okay, great. Next question. Have you seen speech problems from long-term use of a pacifier?
I have, because it will change the shape of the kid's maxilla, their top jaw, and their mandible, their bottom jaw. And I think on top of that, it starts to almost, their tongue almost goes out of, it doesn't work anymore. It literally is put to rest. It's not moving around their mouth at all during the day. So you'll see a lot more kids, I think, then it's harder for their tongues don't move around as much. They don't build the muscle tone in their tongue. The issue is then their jaws have changed shape. So like try to say the word like left. Your tongue has to come up to the tip of your front teeth. If some kids' teeth are pushed out from that pacifier, it's going to be very hard to say those words. So you can. And that's why I'm a big proponent of trying to get that pacifier stopped by 6 to 9 months. And then by the time you really get around to it, it's about a year, to kind of minimize or kind of eliminate or any kind of damage that would happen structurally that, again, could then in turn lead to some speech issues with the pacifier. So, but I've seen it happen more than enough to, the sooner you get the pacifier out of there, speech typically will start to pick up pretty soon after.
Great. Very interesting. Okay, looks like this is our last question, and it was a follow-up to Becky's original question, which was, are pediatricians trained to catch tongue ties? And she had asked, who do you go to for a second opinion?
Becky, I'm not sure where you're located at, but I mean, I'm obviously in Philadelphia. We have offices throughout the greater Southeast PA, New Jersey, and Delaware, but I'm not sure where you're at. So I would start by talking to your pediatrician. You may kind of fall on deaf ears, and then talk to your dentist or whoever your kids see, or really, logistically, it really depends, where you're at. I do see people drive in from Lancaster and the Lehigh Valley down here to Philly to see us. So again, I'm sure you're within the broadcast area here. So again, go to our website, send me an email, reach out. I can definitely kind of help you out with anything if that helps you, and then maybe point you in the right direction logistically, or if we can see in, we'll see in and we can help you out.
Great. All right, couple more questions coming through. We'll take these last two and then we'll jump into wrapping up here. Someone had asked, I can imagine a pacifier is problematic with breastfeeding. Is there a recommended time frame to begin pacifiers if cessation is 6 months?
Yeah, we suggest delaying the start of a pacifier until breastfeeding's going well, usually a couple of weeks. 2 to 3 weeks, you might feel like you have things down, and then it's not going to interfere too much with breastfeeding. But I always say, like, I'm not at your house at 3 o'clock in the morning either. I feel like if families need to use it, just use it sparingly in the early weeks for those emergent purposes. But what we don't want you to do is to keep offering the pacifier when the baby is rooting. We want you to put the baby to the breast to stimulate milk production.
Great. And it looks like, we already answered this question, but do breastfeed babies have more cavities? You just want to address that one more time. Dr. Bonner, Dr. Scuia?
So the answer is not necessarily. There's lots of factors that influence whether a child gets a cavity or not. So breastfeeding exclusively does not give your child cavities, but how well you're brushing, what kind of bacteria they have in their mouth, how many teeth do they have, what's your brushing routine. So I always say, go to your pediatric dentist, discuss your specific situation, and then, go from there.
Great. Thank you, everyone. We appreciate you guys taking the time to join us today. And if you just want to scroll back on this one here quick. Okay. We're excited to offer our new baby oral health exam for children under 3 years old. At your child's appointment, you can expect your pediatric dentist to check your child's baby teeth are developing properly, that there are no signs of tooth decay, and make recommendations on a proposed treatment plan and those next steps. Please download our maternal timeline PDF that we are going to share right now. It's an excellent resource for moms and dads to learn a little bit more about their little one's health, oral health journey. And then at this time, we'd like to announce the winner of our giveaway. So picking out of a hat here, it looks like Rachel Cockerham, you have been selected as our winner. Congratulations. You'll receive an Honest Company baby gift set and the Brushies book with toothbrush for babies. So we'll be sure to follow up with you via email for details and get your shipping information. And thank you for being here with us today. We also did include the Lancaster baby shower link in the chat box in case you are interested in attending. And we plan to do more webinars in the future, so keep an eye out on social media for upcoming virtual events. You all have a great weekend. Thanks so much. Take care.